I was an average weight as a kid. I look back at pictures of myself, and it wasn't until I was about 9 or 10 that I started to gain weight. And I just had some traumatic things happen as a child. And my parents weren't aware of what happened. And I watched my mom be a size 4 and eat an entire bag of Hershey's to deal with her emotions. So as I got older, I kind of learned, oh, that is how you deal with your feelings. That is how you deal with the negativity in life, is eating. And you can see in pictures from when I was 9 to then when I was 12, I was gaining weight and gaining weight. And my weight just kind of went up from there. I was a late bloomer because I had polycystic ovarian syndrome, which I was diagnosed when I was 16. I actually had to have I had my left ovary removed when I was 18 because of a large cyst. And the weight, I have it probably around 220s for most of my late teen years and my early 20s. I kind of got over what happened as a kid, but then life, as an adult, it's not what you think it's going to be. Trial, tribulations, and then just honestly, the depression, anxiety from just becoming overweight. I have tried every single diet you could ever imagine, from, whole foods to veganism to my brother convinced me to do white boiled potatoes for a few months just to lose weight. I've just done keto. I did it all. And yeah, so I struggled pretty much for the past, I'm 33 now. So 20 years of my life dieting, gaining, losing, gaining, losing. I actually have a background in physical therapy. I've been doing physical therapy for 10 years. I don't actually see patients anymore. And that was because of the huge deterioration in my health and my mental health that led me to stop seeing patients about 2 years ago when we moved up from Arizona to up here. And yeah, so that's just kind of the genesis of how I got where I got. Honestly, one bite at a time, one not so great health choice at a time. And yeah.
Yeah, I'm glad you point out, because a lot of people eat for really non-nutritive reasons. We sometimes we eat out of emotion, eat out of comfort, eat out of boredom, eat out of social pressures, and a lot of things that go on. And it's very easy to do. I mean, it's certainly, it's like just mindlessly sitting in front of the TV and eating a bag of potato chips or something like that. It's something that probably all of us have done at one point, or most of us have. And it's like I said, it's not, we don't need to do that, obviously. You said you were 220s, by the time you're, I guess, in your teens or something. Do you know what your peak weight you got up to? What was your heaviest, or do you know?
In my 20s, the heaviest I got up to was like 246. My heaviest overall in my life was 360 pounds. That's where I started at when I started Carnivore.
Wow, 360. Okay. Yeah, I just got to mention, I was just looking at I was just on my social media on Twitter, and there's a gal in Arizona who was in a nursing home at I think she was about 550. Now she's down to 370. So she's same thing, carnivore diet, and it's just amazing to see. So, you tried all these diets over what polycystic ovarian syndrome, which is becoming more and more common, and so there's a lot of thought that it's related to insulin resistance. And, sometimes they put people on metformin for that, to kind of, recognize some of that physiology. What other, you said mental health took a deterioration. Were you formally diagnosed with a number of different conditions, or what was going on besides just being overweight? What other issues did you have?
I've actually been on and off antidepressants since I was 12 years old. They clinically, I was clinically depressed. And so, here I am 12 years old taking antidepressants. And I imagine that probably didn't help with my weight issue either. So I started off with PCOS. By the time I was 18 and had that left ovary removed, I started having a lot of pain issues, or just noticed. And I remember going to my primary care and saying, doc, I feel like a 70-year-old. I'm 18 and my joints hurt, my hands hurt, my clothes touching my skin, all this. And he kind of just laughed at me and did some blood work. And my dad ended up sending me to the Mayo Clinic in Arizona, because at the time I lived on the other side of the country. And they thought I had lupus. I really didn't do anything about it, because I'm just like, they're going to put you on prednisone. They're going to stick you on steroids, and I'm already fat enough. So I just ignored it for a handful of years. Then it got so bad that I went back when I moved to Arizona with my husband. They finally diagnosed me, and they got a little more advanced in their tests. I have scleroderma, RA, and fibromyalgia. Although for me, fibromyalgia is kind of a catch-all. They don't really know what to diagnose it with, so you have fibromyalgia. So I have 3 autoimmune things going on. I was pre-diabetic most of my teenage life and into my 20s. I actually was not fully type 2 diabetic until probably my late 20s. Fatty liver. It got to the point where I had tinea versicolor, which is like a fungal skin growth. It's just overgrowth of yeast on the skin that got way out of control. Lipidemia. I started having this feels like pearls underneath the skin from just uneven, disposition or deposits of fat on the body. Oh God, the list. I had 16 comorbidities when I started this.
Wow. Oh, that's a tough, I can see where even if you didn't have the biology for depression, I can see how that would be kind of a depressing existence, to be honest. I mean, let me ask you, you said you've been on all these diets, and obviously you've seen a lot of physicians if you've had all these health diagnoses, and you're kind of right. Fibromyalgia, they just kind of throw it in there, and then they throw you on some antidepressants and say, we don't know what causes it, type of thing. That's typically how a lot of it is treated. But during that time, what were the interventions that the physicians were willing to do? Did they talk to you about? I mean, I'm sure they talked to you about losing weight. I mean, I can't imagine they didn't. But did they give you any good plans, or what was the typical advice that you got?
Metformin was the first thing for the PCOS. It was actually an OB or a gyno that diagnosed me. He said this will help with the weight. It didn't really do much with anything. The biggest thing I was told is eat less, move more. It was probably the number one thing. They sent me to nutritionists, but the nutritionists were low fat, high carb, and I just was hungry all the time doing it. I mean, hungry all the time. My only blessing, I think, in my later teen years and early 20s is I was helping remodel houses. So I literally was digging post holes and moving dirt around. And I think that's the only thing that really kept my weight down, is I was very physically active. Other than that, the best success I had prior to Carnivore is I actually went and saw a nutritionist myself. I found one. And I remember her telling me, she said, everything she learned in school was absolute trash. She said she got out of school, started treating her diabetic patients and even herself with this, low fat, high carb, and they just got sicker. She said she had to do a lot of learning and searching and continuing education. She found low carb was absolutely the best method to deal with people. I had actually pretty good success on that. I lost like 40 pounds, but it still did not address the mental component of the binge eating for me. And that has been the game changer with doing carnivore, is from keto to carnivore, is it completely makes me address that binge eating I have.